So it's really comparing side to side for any symmetries. So one thing I want to mention, when you're doing a glide, always visualize your joint. You want to see and have the like what's beneath the skin, you have to imagine it. So if we're doing talocrural joint, we're going to be moving talus on tibia. So our first glide is going to be posterior glide for dorsiflexion. So if we look at our dorsiflexion movement, we can see that which way are we going to have to glide the talus? If we're limited in this movement here, which direction do we glide the talus? And which bone is convex, which is concave? So is our tibia convex or concave? Concave. And then we have our talus that is convex, right? So you can see that nicely here. So then we know that we are going to have to do a posterior glide of our talus in order to improve dorsiflexion. Then it's going to be the opposite when we want to do our plantar flexion. So always visualize that. It'll become second nature. Nowadays when I'm doing a glide, I'm not even thinking about it. I know which direction to do. But right now you have to always keep that in mind. So can I have my volunteer? Have you had any ankle sprains or anything else? So you want to use a roll. You can put that under the knee. Actually, I know in the picture it says ankle, but you can put it under the knee to stabilize the joint a little bit. Just like I remember. So that is it. Yeah, if the bed is uncomfortable when you put pressure, so if they're having pain here, you could also put another towel here if you wanted to. You want to make sure that the plinth is not going to be limiting your movement, so just come off a touch. Yeah, up a little bit. Right there is good. So this can be used to assess. So you're first going to do an assessment. So especially if you were doing any movements that did dorsiflexion, so when you're doing your squat, if you saw a limitation or they reported a limitation, then you might suspect that you'll find a limitation here potentially. What you're going to do, you're going to stabilize your tib fib here. You want to come and localize your talus. So most common error is to do it too low. You really need to be at the joint line. So remember, with all glides, you want to be as close as you can to the joint line. So often your hands are going to be either touching or close to touching. You want your foot to be in resting position, so just about 10 degrees plantar flexion. So you will have to bring your ankle up. So I use the fingers here to bring it up and hold it in that position. And then what you're going to do, you're really stabilizing. So I'm kind of pushing down towards the table with my caudal hand, or cranial hand, sorry. And then I'll be using from this here, so not really the whole hand, because I don't want to do range of motion. I really want the axis to be right down here. So bringing up into 10 degrees, this hand stabilizing, and then my caudal hand is going to do the glide, and then pushing downwards. You're going to be looking for your neutral zone, R1, so your first resistance, and R2, your last resistance. And then come out. You're also looking for your end feel, and you're looking for pain. So in an OSCE, you're going to be saying that. I'm doing a neutral zone, do it as you, say it as you're doing it. So here I'm in neutral zone, R1, R2. You might do it a couple times, neutral zone, R1, R2. How is that? Do you have any pain? No? And take a note of what your end feel is. The goal is for you to feel what it feels like also, and compare to the other side to see if you have a restriction or not. Any questions on that? So now we're going to do the opposite. So if we wanted to improve plantar flexion.
Sorry, we got one question, sorry.
Yeah. I can't hear the question. I don't know if someone asked it. Can you text the question, maybe? I'm not hearing it.
Yeah, can you say the question? Yeah. Oops, sorry, that was me. Just put your podium mic on because we can't hear.
Okay, now can you hear me?
Yeah.
How does R1 and how are R1 and R2 differentiated?
So your first resistance that you feel and then your second one. Are you really going to feel that yet? Probably not. Okay, it's going to take some getting used to, but you're looking for that. That's what you're trying to look for. Once you've been practicing for a while, you'll really know what it is. So right now, just try to see, what the resistance is like. How far can you go? And try to feel for, okay, here I don't have resistance. If I press a little bit more, oh, I'm starting to feel resistance. And then how far can I go? Where's my last resistance? It won't be very clear to you yet. The more you do, the more you practice, the clearer it will become. I hope that helps.
And maybe just to mention that to know if you've gone too far, look at the knee. If you see the knee starting to move, I'll just zoom out and like Crystal overdo it, okay? So if she pushes too much, go ahead.
You might see a little bit of knee movement when you're doing it, but if I'm going like this, that's too much. I should not have movement at the knee, or very, very minimal. And we look for that in our skis as well. Okay, so doing the opposite. So again, this is going to be to improve plantar flexion. So if you're, up on toes is limited or something like of that sort, then you might suspect you'll find something here. You're going to come stabilizer to fib, hand around talus again. And you can wrap around to the posterior part of your talus. And again, you're going to bring your foot into that 10 degrees resting position, and you're going to glide upwards. So notice that I'm not pushing and pulling with this hand. Most common mistake is this. This is not what you want to do. You're stabilizing, so my cranial hand is never moving. It's just my caudal hand that moves. Again, you're looking for a neutral zone, R1, R2. Looking for pain and pain with that. And looking for your end feel, and then you would compare with the other side to see if you have any differences. Questions on that? Okay. So again, done for assessment, can be done for treatment as well. If you're doing it for treatment, then if there's pain, you're going to think grade 1, grade 2. If you're looking to work more on range of motion, you want to improve their range of motion and they're not having pain, then you're going to go into the grade 3, grade 4. So now we're going to do traction compression. So again, we want to be at the talus. They need to relax their foot because you'll see they have a nice tendon that's going to pop up here that might limit you. So have them relax their foot and really come close to joint line again. So I don't want to be too far away with this. I really need to come and nestle right onto the talus. And I'm going to keep my elbows close to myself. I'm again bringing the foot into sort of a resting position. And then I'm going to be moving my whole body this way to pull, keeping my arms locked in and pulling this way. Again, you want to make sure if I pull a lot, I'm going all the way into the hip. That's not what you want. So make sure you're just doing it in the ankle. You might even start to feel it in the knee there. So where are you feeling this? In the ankle. So check with your patient, look for movement, check with your patient also where they're feeling that, and then you can compare. So again, you're looking for how much movement you're getting, if they're having any pain, what your end feel is. And it says also neutral zone R1, R2. It's a little bit less clear with this, but you can also look for that. Then we're going to do compression. So with compression, again, you're going to stabilize to fib. Come into this position here, and you're going to push this way. So you're pushing along the axis of the tibia bone. So again, it's not both hands coming this way. This one is stabilizing, and really the caudal hand is pressing. So, yes, very important. I want you guys to tell one another if it's painful. So if the hand, because I might be asking her, is it painful? She'll say yes, but it's actually my handling that's too strong or just not at the right place. So sometimes you have to reposition your hand. So check with your patient to see is this comfortable for you, and then you can continue. So with the traction, what you're trying to do, is there not something here? So So with traction, your goal is to open the joint. So like this. With compression, your goal is to compress the joint. Okay? So you guys have about, yeah,